Hi everybody. I wanted to take a few minutes to introduce you to somebody that's one of my absolute favorites. Actually, we call him the best chiropractor in the cosmos, and that's Dr. Robert Sierszulski, but I'm going to call him Dr. Robert from now on because I will stumble over his last name, as I just did. Dr. Robert, you have a wonderful practice here in Wheaton, Illinois, called Chiro Solutions. How long have you been there?
3.5 years.
3.5 years, and let me tell you folks, he's a busy guy. He really is a busy guy. And for those of you who don't know, I am an extreme advocate of chiropractic care. And I wanted to take a few minutes to discuss with you today, Dr. Robert, what you see as some of the questions people always ask you about chiropractic care.
Typically, it's why does my neck crack, for example, when I turn it to the side? Oftentimes what that means is hypermobility of the spine. There's different segments of the spine that are just moving too much, and they're what we call autocavitating, meaning that when a chiropractor, for example, puts a thrust into the spine, it makes a cracking sound. That's gas being released from the joints.
What kind of gas?
Mainly carbon dioxide and a little bit of nitrogen.
Okay.
By Boyle's law, it disperses outside of the joint, reaccumulates usually within about 20 minutes or so. But that hypermobility is what's causing that cracking. Okay, so if this is a joint that's moving too much, the joints above and below it will be moving too little. Okay, so as me as a doctor of chiropractic, those are the joints that I adjust, because those are the ones that are causing dysfunction and pain and inflammation.
Okay, so one of the questions I'm sure that you wish people would ask is fill in the blank, because a lot of times, you know, we as professionals, people come to our office and we hear the same questions over and over, and in our head we're saying, I wish you would ask this question. What question is it that you wish a lot of your patients would ask you?
Can you help my friends? Can you help my family member? Can you help other people with similar conditions, other conditions, strange conditions, conditions that can't be, for example, treated with the medical model of treatment with drugs or surgery? Someone that can be helped with a more of a conservative approach, not using drugs or surgery.
You know, and I have brought my own mother-in-law in to see Dr. Robert, and she was very impressed with his care. And for those of you who have senior parents or grandparents, he's very, very, very gentle with them, and you use something called an activator gun. So some people are afraid of that big, huge cracking sound, and they think they're going to jump off the table. Tell them about the activator gun, because that's one of my favorite things, is the activator gun.
Yeah, an activator is not a shoot 'em gun per se, but it is a spring-held adjusting instrument. So in those cases where there's contraindications to regular adjusting, or if a patient is, for example, anxious and they don't want to get their neck cracked, is the one I get kind of more often than not with these types of situations, no problem. There's other safe, gentle, and effective ways of adjusting, one of them being the activator. So basically it almost looks like a syringe. There's no puncturing of the skin, and once I put it onto a joint, let's say it's the elbow, it just clicks. Force equals mass times acceleration. This is Newton's second law, of course. So it has a small mass but a large acceleration, so the force is still the same. So it's actually a wonderful instrument, but I do many other different techniques, including the use of my hands and a drop table technique as well. So everything works, and I always specify my treatment to what the patient's coming in for and what I feel is going to be the most effective for him or her.
I see. Well, you know, and I noticed you used that activator gun on my mother-in-law's arthritic toes, her arthritic hands, or arthritic arms, and it really did accomplish the job for her. She did have some movement. She was kind of worn out, but then again, she is 88, so
right.
What do you expect? I wanted to address something that you just said, adjusting the neck. So many people are so afraid to have their neck adjusted. And you and I, because I'm also trained in chiropractic, but no folks, I do not do it in my office. You and I both know the risk is so nil. We want to talk a little bit about that. So many people talk about the risk of stroke and, oh, you know, they think their head's going to fall off in your hands and all those kind of things.
Right. I mean, you always want to err on the side of safety, of course. So if I have a patient that has, for example, atherosclerosis, which is a plaquing of your artery, where they're going to be more at risk for stroke or heart attack, regardless of whether they're getting adjusted or not, okay? I tend to not do those types of what we call high velocity, low amplitude techniques on those types of patients. Now, is there a real risk? Not really, as far as I'm concerned. There's a higher risk of dying in a plane crash than dying from a cervical spine, which is your neck adjustment, with a chiropractor's hands, okay? So I think what ends up happening is more fear gets into our head because there's a cracking sound. It doesn't feel normal, and we watch too many Rambo movies. Yeah. So I think we're all under the impression that this can be something that's deadly, and that's definitely not the case.
Right, so correct me if I'm wrong. Doing the cracking of the knuckles is the same
Correct.
as getting an adjustment.
That's correct, as far as the sound is concerned.
Right,
yes.
as far as the sound, and maybe even some of the movement, huh?
Yes, it depends, right, exactly.
So a lot of these people, I know that we've talked many times about you help pregnant women get baby turned, or pregnant women with their lower back problems. Which brings me to the next thing I really wanted to talk about. Tell me about adjusting the spine and organs.
Yes.
Not organs.
Right. So there's something called the Merrick chart, which basically describes different neurological levels of your spine and the organs that they relate to. So when we talk about the spine, we have spinal nerves that come out of the spine that lead to skin, muscles, every single cell in our body, including our organs. But there's different levels of our spine that'll, for example, affect the pancreas or the stomach, or small intestines, large intestines, even sexual organs. So when I have a patient, let's say, for example, I had a case with a woman. She was trying to get pregnant for years. She came in for one adjustment. I did adjust the low back, and this happened to be L3, and she became pregnant just about a week or two later. Okay, so I believe in this particular case, of course not my baby, in this particular case what ended up happening is I got the spine to move, and the neurological association between L3 and those sexual organs was improved. So even though your organs will function without any nervous input whatsoever, there's going to be a dysfunction, and there's so many things that have to go right in order for a woman to get pregnant. So I believe that was the last factor in this equation that was overlooked by her medical doctors in this case. So I'm very happy to have helped her out, and in fact I was just adjusting her brand new baby boy, my youngest patient yet, 23 days old.
Ooh.
That's right. So.
And for those of you thinking that's too young, I had both of my daughters adjusted when they were 1 day old.
Oh, excellent.
Yes,
excellent.
we want to make sure. So if you're ever thinking, oh, I don't know about this chiropractic stuff, you need to rethink, because chiropractic is on the move. And what a lot of people don't know is that you and I share quite a few patients.
Exactly.
Because when you adjust them and you get their organs functioning, what happens then?
Well, basically, I can't do any. Well, I don't do anything on a nutritional level, and that's where you come in with your naturopathic techniques, your counseling, and all the supplements that you can prescribe for these types of patients. Right. So, as far as enzyme deficiencies or other kind of nutritional deficiencies, I'm more of a biomechanical doctor, and that's what I am interested in, and that's what I partake in. But as far as those types of problems, I always refer to you, because I know and I trust your care. And you've gotten some great results with my patients in the past, so I'm very grateful for that, and including myself being a patient of Dr. Ray's.
Well, thank you. I'm also a patient of Dr. Roberts, so now that we're done kissing each other on the cheek, but what I wanted to say is the people that I've referred to him have been I've gotten emails at midnight telling me how much they actually love his care. What I wanted to tell you about Dr. Robert is he's extremely thorough. He will go over every aspect, if you want him to, of what you need. He will definitely take the time with you, or he will not take the time with you. If you just want to come in, get adjusted, and walk out, well, that's your prerogative. But he will take the time because he's extremely knowledgeable, and that is, in my opinion, what makes him the best chiropractor in the cosmos.
Oh, thanks,
Dr. Robert.